Joining us from Baton Rouge is Congressman Bill Cassidy, as I said, Republican from Louisiana, a gastroenterologist, first-term doctor. Congressman Cassidy, good to have you on the show.
Carlos, glad to be here.
Congressman Cassidy, so you heard the conversation that Roy Seekoff, Mike Vaquera, and I were just having here about the viability of a public option, about whether or not Democrats have been aggressive enough in utilizing the 60 votes that they do have in the Senate.
Really?
Now, you're obviously on the other side of the aisle, on the other side of this issue, but your thoughts, just as someone who follows politics closely, about whether or not Democrats have been aggressive enough with the 60 votes that they've had.
Well, it's a very Washington-centric perspective, no offense, Roy, because you're assuming that we're something other than representatives. As it turns out, I suspect if you poll this nationwide, but certainly if you go to town hall meetings, you will see that the people here want to be heard. So if we take the Washington-centric view, we can vote independently of what we're hearing in our community, then, Roy, you're absolutely right, man. We just need to have 60 votes. Boom, we're out of here. But if you say, wait a second, what are we hearing? We're hearing that people all the way from the moderate left to the right are concerned about cost. They're looking at a CBO report that says that the inflation rate of the president's plan, or the HR 3200, is 8% per year, which, by the way, if you compound that interest, if you compound that, at the end of 10 years, your cost more than doubles. So when the president says status quo leads to doubling of cost, the reform more than doubles cost.
Congressman, if I may though, if I recall November, the president ran on that he was going to have health care reform, he was going to have a public option, and he won the election by a majority of the people. It's not Washington-centric. It's all across the country.
If you go back to November, you'll remember that the president said that he was going to insure everybody and decrease premiums by 25%. Now, he specifically said, I'm going to decrease your premium by 25% and not raise taxes. And so I actually think...
Well, I think he said he was going to raise taxes, but on the highest earners. But go ahead.
But he was going to lower premiums by 25%. Clearly, that's not going to happen. Indeed, if you say that we're now going to potentially tax in some way, directly or indirectly, the amount of money that people are receiving from their employer to pay for insurance, we're actually going to have an increase in cost. So I think if we just take the viewpoint, Washington-centric, we can vote independently of what we're hearing back home. You're right. You can get it through.
But, Congressman, let me ask you this. If you take that perspective, as someone, not only are you a doctor, but your wife is a physician as well, and so you know the healthcare arena very well, very intimately here. Do you not agree that left to their own devices, the private insurance companies are not about to lower cost, and without some kind of meaningful and aggressive public option, whether or not the public option on the table right now is the right one is a different story, but without some kind of public option, I don't see a realistic way that you are going to see that decrease in premiums that the president talked about and that you and I and everybody else seems to want to see?
A couple things. One, you got to, the crazy thing about this plan is in one way it's not radical at all, because it actually just takes the private insurance paradigm, top-down, let's deny service, and it makes it a public insurance paradigm. In one sense, the only thing transformative is it transforms the private sector to the public sector. But beyond that, it's not transformative. Again, I am quoting CBO. When CBO said the reason that there will be an inflation rate of 8% per year, which is more than the current, they said because it is not transformative. Now, what will be transformative, which I know working as a physician, by the way, in a public hospital for the uninsured for 20 years, is that if you make something patient-centric, where the patient is in the middle of the process, that's when you control cost.
But let's stay on that then, Congressman, because I've been waiting to hear you and a number of other conservatives say exactly that, to say, instead of saying the president's going too far, to say what I think you could be interpreted as saying, which is the president's not going far enough, that he should be pushing the insurance companies, that he should be pushing Big Pharma to some extent, and frankly, he should be pushing not only some of your colleagues and doctors, but some of the lawyers as well, that he should be pushing everybody harder in order to lower these costs while increasing coverage and increasing the ultimate results in terms of actually good health care service for more people.
Carlos, my fear is that the president's going way far in the wrong direction. He's pursuing the wrong paradigm, which is the traditional paradigm, which is not transformative. Again, I'm quoting CBO when we say it's not transformative. What would be going in the right direction, which he's not going in at all, is putting the patient in the middle of the process. McKinsey & Company, objective, third-party group, has said to transform health care, you need three things. lower administrative costs, incentivize healthy lifestyles, and transparency of cost. In H.R. 3200, there is minimal attention paid to things which can truly transform the healthcare system, which is those three things.
Congressman Cassidy, we're going to take a quick break, and when we come back, I want to talk about that. I also want to talk about another one of the issues that you focus on a good bit, which is education and the president's speech coming this Tuesday.